Badger State residents over the age of 65 will soon be eligible for the COVID vaccine.
Vaccine rollout will begin January 25th for that demographic, following an announcement by the State Department of Health Services.
Still, many questions remain. Who do you contact to get a vaccine? Do you call them? Do they contact you? How will local health departments manage this distribution? And finally, how long will rollout take?
McKenna Alexander spoke with a bevy of health officials, both state and locally affiliated, to provide insight on some of these common questions.
The next group of people is being called to the front of the line for their COVID-19 vaccination, but that line could be a long one. Right now, the federal government sends the state around 70,000 doses per week. And according to the state DHS, there are 700,000 people in Wisconsin who are 65 or older, meaning at this rate, it would take roughly 10 weeks to vaccinate everyone in this age range. In Eau Claire County, the health department estimated this group to be 17,000 residents, which means distribution may take some time.
We know it will take several weeks. We're hoping fewer than 10 if we get more vaccine allocated. We have capacity to do this in a shorter amount of time if vaccine becomes available.
Some counties, though, are still deep in the process of administering vaccines to Phase 1A, such as Buffalo County. Health officials there say this next group of adults 65 and older will have to wait a bit longer to get their vaccine. Lisa Gagese, director of the Eau Claire City County Health Department, says there isn't a rule saying you have to live in the county in which you get vaccinated, but it is recommended.
The goal is to really focus on having people get vaccinated where they live and where they, again, currently have a health care provider. Certainly, vaccine is available in other communities, but we don't want to be in the place that other states have been where people start shopping around to see where they most quickly can get vaccinated. The goal is to do this as efficiently as possible.
One of those providers is Marshfield Clinic, which is preparing to up staffing in order to meet the demands of such a large vaccination group.
We are going to have to increase. Right now, the hours are Monday through Friday, 8 to 5, but that was when we had that smaller group. So we are putting together right now as we speak, logistically, how can we increase that time to 7 days a week, Saturday, Sunday, and we'll have that very short order. So we will be increasing accessibility.
If you choose to receive the vaccine via your healthcare provider, in most cases, they'll be contacting you directly to schedule an appointment. If you don't have a primary care provider, you can schedule a vaccination at a pharmacy, and if you live in a care facility, such as a nursing home, you'll be vaccinated there. Again, even if you are in this now eligible group, it could still take a while. It depends on vaccine allotment and how efficiently the vaccines are administered. State health officials predict this rollout will take several months, but assure every person that is eligible for a vaccine will receive one. Once Phase 1A begins to reach completion, only then can vaccines begin for the next group. In this case, adults 65 years and up.
Think about boarding an airplane. They call for Zone A, and a whole bunch of people get on the airplane. And when the line starts to come to a trickle, then you call Zone B. And that's where we're at right now.
Frontline care workers, residents in long-term care facilities, police, fire, and EMS personnel are still eligible for the vaccine if they've not gotten it yet. State health officials will vote on other groups to be included in this next phase of vaccinations as the week goes on. In order to bolster the vaccine response, Governor Tony Evers also announced an extension of the statewide mask order today, signing a fresh executive order to continue the safety measure.